Ioana, and I am an interpreter. Welcome back to Mirror Interpretation Todorova. I am so excited for the project that I start today with Rosa, who is located in sunny Hawaii. We are going to create bilingual videos that are gonna represent the words that you may encounter in your bilingual medical test. So I make about 15 videos, and you guys are gonna be able to see it here in my folder, who is gonna be called Spanish Bilingual Medical Test. One part we're gonna give you in English, which is gonna be me with my Eastern European accent, and Rosa is going to give you the Spanish version. She also have a great British English accent. I'm sorry you guys not able to hear it unless she represent herself, but in this video we're going to give you about 30 medical terminology who are mixed and who are eventually gonna happen in bilingual medical test trainings that nowadays during COVID and after COVID, many companies start to do for the interpreters. This type of test include CCT test and P4 or Lingual 4, level 4 of language proficiency test. Some of those terminology you can meet in a STAT test. If you watch my previous videos, we talk about the two type of medical tests that you can encounter. One type includes 50 words of medical vocabulary, and then a medical and doctor or patient encounter scenario. Either way, if you don't have the 50 words that you have 3 seconds to give it to the target language, you will need those terminologies to pass the test, because there is a lot of medical scenarios that ask questions that are one after another with terminology that you should know. So thank you for being here, liking, sharing, subscribing. Please put your thumbs up, and I will give the word to Rosa. Please, Rosa, represent yourself, who you are, what you do, and welcome.
Thank you, Joanna. I'm very honored that you wanted to do this together. And of course, I'm excited. Anything that it is about creating educational materials to help the interpreting community get better and know inside information from experienced interpreters, I'm on board. So thank you so much. Again, my name is Rosa. I'm also an interpreter. I'm based in Hawaii. My language combination is English, Spanish. I mostly work in the healthcare field remotely, but I also started interpreting in court this year. And I'm really excited to be doing this with Joanna today.
And can you tell us your YouTube channel name so eventually my subscribers can follow you, because I enjoy your videos. I think you're very organized and you have a lot of organization skills, which I am not so good with, and I kind of admire you for that. So if somebody have like similar character, they will love your videos, and I like to share them with you. What's the name of your YouTube channel?
Thank you. Actually, before I do that, I love your style. I've already expressed that before. You're so honest and so authentic. I enjoy your accent very much. So I really like that. And my channel is called Interprepedia. Um, yes, you can find it on
Like
YouTube.
encyclopedia for interpreters,
Like a
something like to
Wikipedia. It's yes,
just for
exactly.
the, I think that's a great target name. I love your trade name as
Thank
well.
you.
Okay, so we are ready to start, guys. How I'm going to do this, I'm gonna give a word in English, and Rosa is gonna give it in Spanish. I love Spanish. Yo también hablo un poquito español, but my Spanish is not so aristocratic. Let's say my Spanish is like just good enough to travel, order food, and get angry, but it's not like a professional level of Spanish. I am so sorry that my video got so bad. Okay, now it's better, right? It was so light. So let's start. I'm gonna repeat. The words are mixed. So normally in the bilingual test, they're gonna be separated by body types, by disease. So there is three separation of the keywords in a medical interpreting testings. The one symptoms, then disease, then body part, then like feeling something or doing something or moving towards something. So a lot of those terms are very strictly packed together in these 50 words of medical terminology, and I am not able to give it exactly as they give it on the test. And if somebody give it to you, you're not gonna be able to do the test because you're gonna memorize them, and then you're gonna think that you know it. And when you go to the test, you're just gonna crash down from the stress or the fear that you're faking it. So I mix them all. So I do everything legal, and I am guaranteeing you that if you watch these 15 videos, you gonna be very, very ready for bilingual medical testing. So we are starting with the first word, which is a painkiller.
Analgésico. Analgésico.
Painkiller. Second word, anti-itching. Anti-itching.
Antipruritico. Antipruritico.
Cancer. Cancer.
Cáncer. Cáncer.
Pus. Pus.
Pus. Pus.
Pain. Pain.
Dolor. Dolor.
Brain tumor. Brain tumor.
Tumor cerebral. Tumor cerebral.
Aching pain or a sharp pain. I cannot pronounce very well aching. Maybe Rosa, you can help me with that. It's
That's a
like
tough one. Aching pain.
aching. Okay, aching pain. Aching pain.
There you go. Dolor incómodo. Dolor incómodo.
Migraine. Migraine.
Migraña. Migraña.
I will add a word here, which is a synonym of migraine, which is a headache. This is very similar as well. Let's do it, Rosa. Headache. Headache.
Dolor de cabeza. Dolor de cabeza.
Then we have a different words that include drops. It could be some drops, cough drops, medical. So we're gonna do eye drops, eye drops,
Gotas oftálmicas. Gotas oftálmicas.
nose drops, nose drops,
Gotas nasales. Gotas nasales.
varicose veins, varicose veins,
Venas varicosas. Venas varicosas.
gastroenterology, gastroenterology,
Gastroenterología. Gastroenterología.
lung inflammation, lung inflammation,
Inflamación pulmonar. Inflamación pulmonar.
asthma, asthma,
Asma. Asma.
sneeze, sneeze,
Estornudo. Estornudo.
sprained ankle, sprained ankle,
Torcedura de tobillo. Torcedura de tobillo.
move or moving to. It's a verb, and in a test sometimes they give you just the word, so be ready just to have the word itself.
Mover o moverse. Mover o moverse.
I want to ask you a question, Rosa, because I speak Italian, and in Italian this will be movimento itself. Is that a similar word in Spanish or no? Like,
Yes, it depends on the context though,
okay.
because
In this
in
case, in
English,
medical, we should think always, forgive me, about medical moving. Let's say, can you move? Movimento, muoversi, no? That's the medical correct word, right?
correct. But in a different context, or depending on how the source message is phrased, if they say, for example, in English, do this movement, then I would say, haga este movimiento.
Claro.
But if they say, move this leg, I would say, mueva esta pierna. So it would be like conjugating the verb to move. So it depends
Wonderful.
on the context.
Wonderful. I just want to make sure, guys, because I know there is some haters in my channel, and I always repeat, be nice, be polite. So we're trying to give you just useful words, and we're always grateful if you write us a suggestions. Please stay positive and don't write any hate comments because I'm gonna block you.
Well, that's a
Let
very good, that is a very, I'm sorry to interrupt. There is a very good comment because the um, options that we are offering here are acceptable, researched interpretations of these words, but it doesn't mean that there's the one way to say this. It depends on the context in many cases. And much like, for example, for eye drops, I say gotas oftálmicas. If you simply say gotas para los ojos, which would literally be like drops for the eyes, is acceptable as well. So these are just options that are researched and acceptable. And like they say, there's more than one way to skin a cat, right? There's not an absolute
exactly.
one solution or interpretation in this case for every single word.
Thank you, Rosa. In fact, let me give you another tip. If you watch my other videos talking about tips for passing bilingual tests or STAT or CAT or whatever the other level of high proficiency medical test or any kind of bilingual test, remember, guys, the most important thing is the meaning. Meaning. No matter if you're in business, if you're in legal, especially if it's simultaneous, and especially in business, I would say, forgetting about one word is not a big of a deal, but if you mess up the meaning, this is the problem. So we are trying to give you some meanings, but you're free to choose your own meaning, okay? Let's go ahead, Rosa. Next word is rush. And sometimes they give it just as rush, and sometimes they say a skin rush. When you do the test, and if you hear only rush, it doesn't mean that you have to hurry, but you gotta remember that you're doing medical terminology tests, and this have to be a medical meaning. The problem is that we don't have a lot of time. We have 3 seconds there, so I will give you the full term, but just remember, if you hear the word separately, you should know that we're talking about skin rush. Skin rush.
Sarpullido, sarpullido.
Joints, joints.
Articulaciones, articulaciones.
We have headache here, but we give it earlier, so we're gonna skip this one. Dizzy, dizzy.
Mareo, mareo.
Or sometimes they give another term that I'm gonna give you, uh, head spinning or spinning of the head or just spinning. It's all related to feeling dizzy. And this what makes the test tricky for you because you have to grasp that we are talking about medical terminology. Do you have a head spinning terminology similar to this one in Spanish, Rosa? I didn't ask you, forgive me, when we were getting ready.
No, no problem. These are very good questions because these are indeed very tricky terms. My personal choices when they say, for example, are you dizzy or lightheaded? And that was one that took me some time to find an interpretation that I felt comfortable with. I interpret lightheaded as aturdido. And when they literally say, do you feel the room is spinning? I interpreted, siente que el cuarto le da vueltas, which would be a very word for word interpretation of, do you feel the room is spinning?
To describe exactly the feeling and make sure they
Exactly.
understand it without being so technical, because a lot of these
Exactly.
people that doesn't speak languages, doesn't have such a high IQ, and doesn't know so complicated words. Just remember that, think about the lab all the time. Let's continue. Chest pain. Chest pain.
Dolor de pecho. Dolor de pecho.
Tooth. Tooth.
Diente. Diente.
Mouth. Mouth.
Boca. Boca.
Syringe or siring. Forgive me, guys. Can you give me a better pronunciation, Rosa? I think you can do it better than me because you have a very light accent.
I'm not sure about that, but I let's try. Let's syringe. Syringe.
Syringe. Okay. It's
Jeringa.
syringa. Heringa? Syring.
Jeringa.
Wonderful. Seizures. Seizures.
Convulsiones. Convulsiones.
Inflamed bladder. Inflamed bladder.
Vejiga inflamada. Vejiga inflamada.
In italiano è vescica inflammata. Guarda ragazzi, we should do a trilingual video sometime. I think that would be fun to do comparison between Spanish and English. I think that would be so much fun because a lot of people that speak English speak Spanish, speak Italian. They think they can speak Spanish and they don't recognize that it's another language. I do, unfortunately. That would be something fun to do with you, Rosa. Write a comment below if you want to see a video like that. Let's continue. We have three more terms left here. The next one is, but before I say it, I just want to give a small clarification here, guys. So we just give a term inflammation of a bladder. Remember, in every bilingual test, you're gonna have at least four, I repeat, 3 or 4 very complicated health condition. Complicated, I say that they are described for more than one word. Let's say cavity of the tooth, inflammation of a bladder, hysterectomy. That would be something very specific. I had a kneecap replacement one time, and there was something about inflammation of the nerve of the kneecap. And the moment that they finished reading, I know what was meaning, but I was not able to put it on the target language. So just remember that 3 or 4 of the bilingual tests will contain these conditions. And let's continue with ovaries. Ovaries.
Ovarios. Ovarios.
And then this word, you guys gonna laugh, but when I had it on my chest, we all know what it means. I heard it and I was like, what? I forget to interpret it. The word was stool. Stool.
That is a hard one because, as we've said, I mean, there's more than one way to skin a cat, and there are many acceptable interpretations for this one. Much like many of the other ones that we've gone through, I tend to go for the most equivalent one and short in case I have to do it in simultaneous and then I save some time. I interpret stool as heces most commonly, but it can also be interpreted as excrementos. But to me, that one is much longer. So I
This
tend
is
to
like
go
a
with heces.
professors in university do, excrementos, I guess. Okay, and then we have uterus, OBGYN again, uterus or uter.
Útero. Útero.
Wonderful. That was our bilingual, I believe that's 27 words. Maybe we did it 30 with some additions that we add today, guys. Before we disconnect with Rosa, I am so happy to have you here, Rosa, and I hope you can join me and make a future bilingual videos.
I'll be
Uh,
happy to. Thank you.
like in Spanish and in English, like this one. Whoever watches, please, guys, like, share, subscribe. I repeat, my channel name is Mirror Interpretation Todorova, and we are recording from Hawaii, where is Rosa, and from Denver, Colorado, where am I? And Rosa, can you repeat once again for your guest and my guest, where are you located and what's your YouTube channel so they can follow you and
Yes,
like
of
you?
course. I'm based in Oahu, in Hawaii, or how they pronounce it here, Hawaii. That probably is for another video, the Hawaiian language. But anyway, my channel is Interprepedia here in YouTube.
And you tell them to like, share, and subscribe because you deserve it.
And yes, 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 the pitch, must not be absent. Please like, share, and subscribe, and watch our videos. I think there's a lot of good material out there that we can all learn from. And I'm so happy to see the interpreting community growing online and professionals becoming more open and willing to share their knowledge and their experiences with everybody else so that we can all learn from each other. I love that. Thank you so much.
Thank you for being here and have a great day. Bye bye.
Thank you. Bye bye.